Derek, I'm going to assess for your neck. I'm going to check if there's any jugular venous pulsation.
Okay.
Okay. This time I'm going to palpate your carotid pulses. I'm going to auscultate it as well to check for any presence or absence of bruit, and then we'll check your brachial artery.
Okay.
Okay. Derek, I'm going to locate and palpate for your apical pulse, then I'm going to listen to your heart.
Okay.
Okay, I'm going to auscultate. Great. Derek, so now we are going to examine your abdomen.
Okay.
We're just gonna roll your shirt up. So inspect the skin for any scars, veins, ecchymosis, rash, striae. Inspect for the symmetry and the contour of the abdomen. Now observe for the contour of the umbilicus. Look for any signs of inflammation or hernias. Derek, this time I'm going to listen for your bowel sounds.
Okay.
Okay. Derek, this time I'm going to percuss your abdomen.
Okay.
Okay, great. So I want you to continue to relax. I'm going to palpate your abdomen. Please let me know if you feel any tenderness or pain.
Okay.
Any pain?
No.
Okay. Derek, we are going to examine now your liver. I'm going to do percussion and palpation. Whenever you feel any pain or slight tenderness, let me know right away.
Okay.
Okay, great. Now I'm going to palpate. Inhale for me, please. Exhale. Do it again. Go in. Do you feel any pain or tenderness?
No.
Great. Derek, right now we are going to assess for your spleen.
Okay.
Let me know if you feel any tenderness or pain.
Okay.
Anything?
No.
All right, now I'm going to percuss. Great. We'll just cut it. Derek, this time we are going to examine your kidneys.
Okay.
Lift your body a little bit. All right. Relax. Now, deep breaths. Exhale. Okay. Now I'm going to examine your aorta. Okay. I want you to sit up, and then we're gonna assess your back. More. All right. Let me know if it hurts, okay?
Okay.
Feel anything?
No.
Anything?
No.
Did you feel any pain?
No pain.
Perfect. This test is the McBurney's point, which is located 1/3 of the way between the belly button and the ASIS. I'm going to push this down. Tell me if there's any tenderness as I remove my fingers.
No.
All right. If there's tenderness, this could indicate appendicitis or peritoneal irritation. The next test is the rousing sign. When there is pain on the right lower quadrant as I push on the left lower quadrant, this could indicate appendicitis.
No.
All right, the next test is the iliopsoas test. I'm going to bend your hip and knee up to 90 degrees. I want you to pull your knee towards your head. This is activating the iliopsoas muscles, which might be irritated if the appendix is irritating the iliopsoas muscles. The fourth test is the obturator muscle test. This is a passive test, so the patient should not be doing anything. I'm going to flex your right knee and hip up, and then I'm going to internally rotate your hip. If this is positive, if the obturator muscle is irritated from the inflammation of ruptured appendix. All right, so Derek, this time we're gonna check your cranial nerves.
Okay.
We're gonna start with the olfactory. I'm gonna put like something on in front of your nose, and you try to smell and identify what it is.
Okay.
All right, close your eyes. Can you tell me what it is?
Eucalyptus oil.
All right.
Because you are like right
All right, Derek. Now we're gonna check your visual acuity. We're gonna check the peripheral vision first. I want you to cover your right eye, and then look at my eye, and I want you to identify how many fingers do you see. Okay? I mean, how many fingers?
Okay. 2. 1.
All right. The other side.
3. 2.
All right. All right, this time, Derek, we're gonna check your cranial nerve 3, which is the oculomotor, cranial nerve 4, the trochlear, and then the cranial nerve 6, which is the abducens.
Okay.
So Derek, I want you to follow this pen light. Please do not move your head, just your eyes. I'm gonna check if there's any involuntary movements.
Okay.
Okay, Derek, so this time we're gonna check how your pupils react to the light. I want you to stare off to the distant object, all right?
Okay.
So considering this area is already dim, all right. Okay, this time, Derek, we're gonna check for accommodation. I want you to stare off at the object, so it's gonna help dilate your pupil. And then I have this pen light. I don't want you to move your head. I just want you to stay still and follow this pen light.
Okay.
Okay, this time we're gonna test your cranial nerve 5, which is the trigeminal nerve. I want you to bite down. I'm gonna feel your Nestor muscle. All right, and then your temporal. All right, I want you to open your mouth. All right, thank you. We're gonna check for cranial nerve 7, the facial nerve. I want you to close your eyes, open, smile, frown, puff out your cheek. All right, so everything you did well, without any difficulties. Thank you. All right, Derek, for your cranial nerve 8, which is the vestibulocochlear, I'm gonna occlude one side of your ear, and then I'm gonna whisper on the other side. Let me know whatever words you hear.
Okay. Rainbow clouds.
All right, and then the other side.
Red, orange.
Okay, so that cranial nerve is intact. All right, Derek. So for cranial nerve 9, which is the glossopharyngeal, I'm gonna ask you to open your mouth and then say ah.
Okay.
All right, go ahead.
Ah.
Okay, so I just want to see that you will allow to go up, which is assuming right now.
Ah.
All right, thank you. And then this time I'm gonna poke your throat just to check for your gag reflex. Okay. Thank you. So for cranial nerve 10, which is the vagus nerve, it's intact because, as you can see, Derek can talk to me clearly without any hoarseness of voice or any difficulty of talking. This time we're going to check for cranial nerve 11, which is the accessory nerve. I want you to move your heads from side to side and then up and down. All right, shrug your shoulder against my resistance. All right, so he did that without any difficulties. And the last one is the cranial nerve 12, which is the hypoglossal. I want you to stick out your tongue and then move side to side. So he did that with ease, so that nerve, that cranial nerve is intact. And then arms out on the side. All right. Now try to reach behind you with your left arm.
I'm not super flexible. Oh, like this?
Yes. And then over your shoulder.
Yeah.
And then do that to the other arm.
Okay. Good stretch.
All right. And do it like this. Just like this. Push up. All right. Now push down. Okay. Let's do it on the other side.
Okay.
Hold on. Push up. All right. Then push down. Okay. Let's do this. You're gonna bend your elbow. Let me know if there's any pain. Any pain?
No.
All right. Now I'm gonna bend your wrist. Any pain?
No.
All right. Let's do the other. Any pain?
No.
Okay. What about here?
Nope.
All right. Let me know if you can feel it, okay?
Okay. Yeah.
Close your eyes.
Oh,
Can you feel it?
yeah. Yep. Felt it. Yep. Yeah. Felt it. Yep. Yeah. Yeah. Yeah.
All right. What about your knees? Can you on your knees? And rotate your ankle this way. All right. Do you feel any pain?
No.
Have you noticed any swelling?
Nope.
All right. Now I have to stand on the side of the bed
Stand up.
and then try to bend down. Do you feel any pain?
No pain.
All right. Now stand up. Stand straight. Arms forward. Close your eyes. Open your hands, palms up. Okay, now put your hands in your arms on your side. Continue to close your eyes. All right. Thank you. Now you can sit down.